How do hypermobile EDS people or people with CCI or cranial instability do on a mini trampoline? Well, let me tell you. If you don't know, I'm Dr. Wendy. I'm a physical therapist. I've taken care of women for 20 years, and half my caseload is EDS, and I'm actually doing research on EDS. So let me tell you, each bendy, that's what I call my hypermobile people, they're all different. Each person's different. Y'all got your own specialties. Y'all got your own issues. Not everybody has horrific cervical instability. So I have some patients with horrible instability, but maybe not in their upper spine, maybe not in their upper cervical. But actually, even in my completely unstable women, they can get on the mini trampoline. But when I say this, I want you to keep in mind a couple parameters. Step one, gentle jumping, like from the ankles, like your feet aren't leaving the trampoline. Think of it more as a lymphatic pump and cardiovascular. Now, my patients have been with me for a long time. They're doing exercises on the table, horizontal exercises. They're probably doing Pilates reformer. They're probably swimming. I have worked really hard with my patients to find an exercise routine that works for them. Some of them can do the mini trampoline. Some of them cannot. Some of them can do the whole body vibration. Some of them cannot. I am all about try it and see. So before I have my patients buy any equipment, they can try any equipment in my clinic. So I have my patients try the equipment and see. Maybe they can do it for 5 minutes, but then they went home and did it for 15 and hurt themselves. So the answer is, how unstable are you? How strong are you to start? How much are you in a flare right now? And where are you in your cycle? So there's about 1 week out of the month where my hypermobile people are like beast mode. It is the week after your period, but before you ovulate. So in the follicular phase, the first half of your period, you are in theory stronger than after ovulation. After ovulation is luteal phase. I wouldn't have my bendies jumping on a mini trampoline in their luteal phase because we know after ovulation you have a higher likelihood of tearing a ligament and such. But I don't want you to be afraid. And I just want to say your cervical spine, muscles, ligaments have a lot of proprioception and awareness of time and space. Putting you gently on a mini trampoline and having you move and use your muscles would actually help your proprioception. But I'm not going to probably use a mini trampoline like the way you see it on TikTok. We're like doing really gentle. But Qigong and Tai Chi can do that level of gentle as well. Now, I like the mini trampoline personally for my house and my family because I leave it out in the living room and my kids love it. They jump on it. My dogs sit on it. I use it. So there's also that piece of it. If you have a child that has hypermobile EDS, they usually aren't as unstable as we are. And so that is a great thing for hypermobile children to gain muscle strength and tone. Hope that helps. Just make sure you are doing your other exercises that are super boring, that are very important for your stabilization. I cannot stress those boring exercises enough.